So the first systems tool that we've explored is the rich picture, and now we move on to the second one, the interrelationship digraph. Both of these are synthesis tools. Using the variables that you identified in the under your variables, arrange these variables in a circle. You can either use Vensim, you can use Post-its, you can use gold-fashioned paper and pencil. Having done this, you start to examine the relationships between each pair of variables that you have identified. So starting with user fee and out-of-pocket payments, and understanding the constructs that underpin this variable name, we look at the relationship of this variable to all the other variables in this circle. So we begin with looking at what is the relationship between individual user fees and out-of-pocket payment and the use of the private sector. The first question we ask is there a relationship? In this case, we decide there is a relationship, and now we need to decide which of the variables act upon which variable. In this case, we decide that actually the use of the private sector is going to drive the amount of money that is paid out by the patient in out-of-pocket payment. And so in this context, and it may vary in different contexts, in this context we put the arrow going in that direction. So here is the arrow that you see. We then move on to the next one. Is there a relationship between self-treatment and out-of-pocket expenditure? And again, we decide the more that people choose to self-treat and self-medicate and simply go to pharmacies and buy their drugs without going through a health system, they're also going to push up and affect their out-of-pocket payments. As user fees increase, and then as the number of user fees increases, we decide there is a relationship between user fees and the utilization of primary care services, and we would argue that user fees would impact the use of primary care services, so the arrow is in that direction. And so we go on. What about the quality of primary care in primary levels, and the amount of user fees and the amount of money paid out by patients? Here we say that the quality of care in the primary level is going to ultimately drive the amount of out-of-pocket expenditure that patients pay. Now, some may argue that this is too distal, this relationship is too distal, and I would tend to agree, and we could choose not to include this relationship. Is there a direct relationship between individual user fees and out-of-pocket expenditure and leadership political will? In this case, you decide there isn't, so there's no linkages. You don't have to have a relationship between two variables. Each one needs to be explored individually. And so you go through each and every variable. Just as an addition, in this instance, we might want to have explored the relationship between staff remuneration and out-of-pocket payment, whereas in most situations, these two are not related in a public sector situation. We do know that in this case, actually, the amount of user fee paid did have an impact on staff remuneration, so we might want to have added this arrow in. At the end of this process, you will have forced yourselves to examine each and every relationship to see, is there a relationship and what is the nature of the relationship between each pair of variables, and you end up with this web-like diagram, which is the beginning of your interrelationship digraph.